Thank you for having me. I'm honored to follow after Dr. Bouchon and Dr. Ball and then teach you some more about caring for adults with ACEs, especially during a pandemic. So let me tell you a little bit about the classical training that I had in internal medicine. It didn't include very much about childhood events. The ACE study was published in 1998, which actually was after my training. Since that time, there's been exponential growth in the interest of ACEs and trauma-informed care training, and lots of publications, mostly in the pediatric world. There has been slow uptake by adult caregivers. The Annals of Internal Medicine, for instance, has yet to publish any articles on ACEs. That's the largest internal medicine publication. The largest internal medicine group, the American College of Physicians, has yet to have anything in its annual meeting about ACEs. And there's no formal curriculum about ACEs in most medical schools, although fortunately that is changing. So let me tell you a little bit about how I got to learn about ACEs and understand ACEs and started to teach it. One of our clinic patients, about 2007, was somebody that was giving our residents a lot of problems. And right before I met this patient, I had been to a talk by Dr. Vincent Felitti. Dr. Felitti, as you may know, was the lead author on the ACE study, and he'd come to Tulsa to give a talk about his research. I was invited to hear this talk, and I was very much impacted by what he had to say. And I started to think, could there be patients that I have seen that are like the patients that he saw? Thinking there might be a few, not thinking there would be very many. So my patient was a 34-year-old female. She was morbidly obese. She was a smoker. She was already on oxygen due to her lung disease, and she had poorly controlled diabetes. I thought, I wonder if this patient might be one of those that Dr. Felitti had talked about. So I dug a little bit deeper into her chart, and I found a social history. The social history was taken by the psychiatry clinic when she had been there a couple of times. And verbatim from her chart, it said she was married, had 3 children, she was molested at age 8, raped at 13, and grew up in a home with alcoholism, instability, and physical abuse. And I thought, wow, I never knew this about this patient. I hadn't known her for that long, but hadn't asked. And I thought, I wonder if there are any other of these patients. Well, over the next several years, I worked with a group at OU to try to find out what was really going on with our patients. So what we did was we did a study where we asked about ACEs along with other social determinants of health for many of our adult patients on our internal medicine and family medicine clinics. And we found that 37% of our patients had 4 or more ACEs. That compared to the original Dr. Felitti and Anda study of 12.5%. So we knew we were dealing with a very traumatized population. But what were we going to do about that? Many times when you tell an adult physician about this, they say, well, what can we do? It happened in the past. Give us an ACEs pill, something that will fix it. But that doesn't really exist. So we went back to Dr. Felitti's words and learned that time does not heal some of the adverse experiences that we found so common in the childhoods of large population of middle-aged, middle-class Americans. And we were seeing that with our population, with their chronic disease, lots of mental health issues, a lot of frustrating patients to the clinician. And we learned that Dr. Felitti's approach of asking, listening, and accepting a patient for who they are is a powerful form of doing that confers great relief to patients. So finding that you don't have to come up with a solution to all of their problems, that just listening, helping the patient connect what had happened to them in their childhood to what was going on in their adult lives and their health, their current health issues, is very therapeutic. One other thing that we learned is trying to help explain these things to patients and help patients understand. We found that the use of metaphors or explanation tools could be very helpful. So we've been using metaphors such as an overloaded pickup truck or an overloaded backpack. And the way you can explain this to a patient is to use the explanation of, say you've got a backpack and all the difficult things that have happened to you starting in childhood and throughout your life become heavy bricks in that backpack. And as you go along and you add more and more bricks, it becomes harder and harder to go through life or to stay healthy. And the good news about using a metaphor such as this one is that you can help patients in the therapeutic part of the discussion of saying, you know, we may be able to work together to find ways to remove some of those heavy bricks from your backpack and help you move through life a little bit better. Another metaphor that we use is something called turning up the volume of especially people that have chronic pain. We help them understand the brain-body connection and how, even though they're definitely feeling pain, the pain may be turned up in their brain because of what they have gone through in their past. And so on the therapeutic side, we can talk to them about, let's work together to maybe find ways that we could help turn down the volume on your pain. So these have been things that have been very helpful in our practice in caring for patients with ACEs. Now we've got the pandemic, and you've heard about all of the health effects of that. COVID is certainly a significant stressor, and even more so potentially for patients that are already stressed out with their ongoing childhood trauma. So there's not a lot of research out there yet about this, but there is this one study from a group here in Oklahoma that looked at low-income pregnant women. And they asked them about their health, their social and economic impacts, as well as perceived change in stress and well-being attributed to the pandemic. And they did this just last year after the pandemic got started. So they controlled for demographics, and they found that those who reported more childhood adversity also reported increased stress and poorer mental health due to the pandemic. They found that this effect was mainly mediated through loneliness, suggesting that ACEs influence pandemic-related distress due to social isolation, or those poor structural social relationships that many of our patients with ACEs have. Now, whether that's really true for all patients with ACEs, we'll come to learn more about this, but this is some preliminary research that I thought was interesting. So let me tell you about a patient that we were seeing in the clinic not too long ago. This is a 29-year-old woman. She had come to us, she'd gained 20 pounds in the last 3 months, as many people have through COVID. Her blood pressure, where it had been controlled, was not controlled despite her taking her medication, and she was complaining of worsening insomnia. I've seen a lot of insomnia in the last year, and what may be related to COVID. So if you look at this patient kind of overall, she had an ACE score of 3, and I say possibly more. We use a conversational approach to screening for ACEs, and we know that she had at least 3 ACEs, possibly more. Her risks for worsening of her stress during COVID are that she was a single mother of 2 young children. She'd had a good job as a restaurant server, but had lost that due to COVID, as many people have. She was currently underemployed, working part-time in the fast food industry, maybe related to some of her obesity issues. And she had no family support because her main support had been her grandmother, who had died recently of COVID. So this was a very difficult case. But the woman did have some strengths that we tried to emphasize. She had partway through a college degree and had planned to complete that. She had a church family. She'd been unable to go to church recently due to COVID, but had stayed connected somewhat to her church family. So in looking at this patient, she certainly had toxic stress from her childhood. That was exacerbated by the pandemic. Contributed to multiple issues, including worsening hypertension, the weight gain, the insomnia. And so this is a patient who, having a high level of ongoing stress, the additional stress of the pandemic just really worsened her health. So we take a team care approach to this patient. So let's look at that. So the clinician can educate the patient on ACEs and that brain-body connection, helping her understand how stress hormones can cause some of the symptoms that she's been having, how the being stuck in fight or flight mode can help her, can certainly contribute to her insomnia, and how the pandemic is another trauma. It's like another brick in her backpack. and that it's very normal to feel the way that she's feeling and that she's going through this with a lot of other people. We can emphasize the self-care, the different mindfulness, exercise, nutrition, and sleep hygiene that you've already heard about. We were able to connect her with a social worker in our clinic to help with the financial issues, childcare, and give her some options for mental health. She chose to work with our in-house counselor, and we're fortunate enough to have integrated behavioral health in our clinic. And we were able to do a warm handoff, meaning we brought our LCSW into the room with the patient as an introduction. And then we have found that many of our patients will have much more success coming back if they've already met our in-house counselor. So we did that. We also increased the number of visits that the patient had been having, more visits to assess project progress, to reinforce those stress busters, see how they're going, see what troubleshoot any problems the patient may be having with those. A continued discussion of the brain-body connection. This is not a one-time conversation. It's an ongoing conversation, and helping the patient deepen their understanding of how their toxic stress can contribute to what's going on in their bodies and their health. So, how about a patient who doesn't have ACEs? This was a patient that I saw. She was one of my private patients. She was 52. She had an ACE score of 0. But her generalized anxiety score was 15, which is pretty high. And she hadn't had anxiety to any degree before the pandemic. She had been healthy. She'd had intermittent back pain due to some arthritis. But she came to me complaining of insomnia, headaches, some GI complaints, some weight loss due to not being able to eat because of stress. So not everybody gains weight. We did a diagnostic workup. We really didn't find a reason for her symptoms. Her risks for worsening during COVID were that she had an elderly mother in a nursing home, and she hadn't been able to visit that mother and was worried about her, as many caregivers have been. And she'd lost touch with some close friends and extended family, partly because of the pandemic, but she realized that she had actually lost touch with several of them before the pandemic, just to her busy work schedule. Her strengths were that she was well educated, she was fully employed, she has a supportive staff, but as I said before, her anxiety was really high. So what do you do in this case? Well, we have found that you can use the ACEs aware approach with a patient who doesn't have ACEs. So we can call this toxic stress. It's a different kind of toxic stress that may occur in childhood, but prolonged stress response without supportive relationships, which was kind of what was going on in this case, can be considered toxic stress. So you can use similar explanation tools as the ACEs. For this woman, we could have said she's got an overloaded pickup truck. Even, through the years, all the stresses in her life have added a brick, a bale, or whatever on the pickup truck. And it got to this year, to 2020, and her pickup truck overloaded, and she's going to have to do something about it. So we talk about the brain-body connection and discuss the stress buster options that you've heard about. For this patient, she was very interested in working on her insomnia, was interested in using the CBTI app for that insomnia. She had been a regular yoga practitioner, but had stopped going because her yoga studio had closed. So we talked about using online options for that. We offered her counseling options, and we really encouraged her to enhance her supportive relationships. Those that she had lost touch with, that she might re-engage some of those relationships to help her and possibly help with those of her friends who were also going through the same thing. So what are the key takeaways? An ACEs-informed approach should be used with all adult patients, especially those who you're seeing for chronic disease exacerbations, new unexplained symptoms, and mental health issues. So the skills and the resources that are learned from an ACEs-informed approach can be used with patients affected by any kind of toxic stress, including a pandemic. So our approach to asking about trauma, asking about what's going on in patients' lives, listening, and accepting those as the what may be really going on with the patient's health concerns, it's really a powerful form of doing that can help a lot of your patients now and after the pandemic.